All of you most welcome. Here we will discuss some of the questions which are image based. So this first question is clearly suggestive of the oil drop sign that shows the parakeratosis, which is clearly seen in psoriasis. Now the question number 2 is the marked bone. The marked bone which you have to identify is incus only. This type of the image is shown in the examination. The marked bone is incus, which you have to identify. The next question is the 11 months old child present with pain in abdomen and the claw sign is seen, which is suggestive of the intussusception. So this type of the image this type of the image comes in the examination, and then you have to identify the claw sign that shows of the intussusception. Now, which type of the scan is this? This image is clearly suggestive of the PET scan, that is positron emission tomography. So that scan is the PET scan. Next question is, now this radiological image, if you carefully examine this image, it is clearly indicative of the bicornuate uterus. So very simple it is, again, bicornuate uterus. Next question is, here you will see in this radiological image the Staghorn calculus is seen. So this is again one of the easy question in the radiological questions. So this is the Staghorn calculus. Next question is, you will see the air under diaphragm, which is suggestive of the intestinal perforation, and the management is emergency laparotomy. Next question is, here the slide shows some of the cells. These cells are called the neck cells, which is suggestive of the hyaline cartilage. So, my dear friends, the next question is the saccular aneurysm is seen in. Answer is subarachnoid hemorrhage. Next question is G6PD deficiency. It affects which metabolic pathway? The answer is HMP pathway. The next question is crumbled tissue appearance seen in which type of enzyme deficiency? The answer is glucocerebrosidase deficiency. That is seen in Gaucher's disease. Next question is complex 4 inhibitors of ETC, that is electron transport chain, is answer is cyanides. Next question is cherry red spots with mental retardation is seen in. The answer is Tay-Sachs disease. So these are also some one-liners which was asked in the examination. Next question is the rice water diarrhea caused due to the involvement of. Answer is GM1 ganglioside, that is caused by intoxication of the cholera toxin. Next question is type of uveitis seen in the sympathetic ophthalmopathy. The answer is panuveitis. Next question is most common complication of untreated radial head dislocation. The answer is malunion with cubitus varus. Next question is primary women with normal regular cycles. Mind it, with normal regular cycles are now delayed for 2 weeks, came with complaints of the vaginal bleeding with abdominal pain. The SCG, beta SCG is 1400, UPT is negative, BP is normal. So USD will show the trilamellar appearance. What is the next step in the management? So the next step in the management is a repeat beta SCG in 48 hours. Next question is patient with a C-section history in the previous pregnancy. Now she is again 34 weeks pregnant. Now USG shows fetus in the breech. The management is one more thing, the patient is insisting for the vaginal delivery. So the management is again the C-section we will do at 37 weeks as vaginal delivery is contraindicated. Next question is this type of the image. Should I just try to draw a similar type of the image in which target sign is seen? So that is indicative of the pseudo exfoliative glaucoma. Next question is here some of the material is deposited. This type of the image is seen in which such type of material is deposited, which is commonly called beta spot, which is seen in which type of deficiency. So the answer is vitamin A deficiency. Now the patient, which is 22 weeks priming, came with severe profuse vaginal bleeding, but BP is normal. What site of implantation caused the profuse vaginal bleeding? So the answer is internal os, which is due to placenta previa. Now question is, the child came with fatigue during the exercise. Differential diagnosis is McArdle's disease. The enzyme defect is asked is, that is myophosphorylase. Myophosphorylase. Now the stimulus for the testosterone release in the fetus is SCG produced by the placenta. Next question is histology image, which was asked in the Michaelis-Goodman, in which Michaelis-Goodman bodies are seen. The answer is malakoplakia.